My name is Dr. Tom Jarnagin. I've been practicing as an obstetrician gynecologist here in the greater St. Landry area since 2004. I graduated from Tulane's residency program in obstetrics and gynecology in 2004. Robotic surgery is a form of minimally invasive surgery. Basically, it's a precise form of surgery. We're using small instruments, making small incisions to accomplish surgical procedures that are traditionally done in an open or more invasive fashion. A good candidate for a robotic hysterectomy in a general broad sense would be virtually any woman who would be a candidate for an open hysterectomy or even a vaginal hysterectomy, with a few exceptions. If the uterus is overly large or you're expecting a significant pelvic mass, then it may not be a reasonable form of surgery. I think one of the biggest pros or advantages has to do with exposure and visualization. We get great views of the pelvic anatomy with the robot. For example, a lot of times I'm a big fan of doing a procedure vaginally if it's indicated, but certainly in many instances we can get much better exposure and visualization by doing it robotically. So if I have a patient where I'm concerned possibly about an ovarian pathology that I don't really know for sure how the ovaries look, a patient has chronic pelvic pain, something like that, using the robot is just a great tool because it gives me that ability to identify pathology and treat it at the same time I'm removing the uterus and the cervix and possibly the fallopian tubes. One of the great advantages that I've noticed just in my own practice, previously I did a fair amount of vaginal surgery, including vaginal hysterectomies, and I've kind of compared those patients that I've done, and I still will to this day do it depending on the situation, but it just seems like because of those small incisions and the technology that we employ intraoperatively, these patients tend to have less pain, they recover more quickly. Oftentimes they don't even fill their narcotic pain medication prescription going home. It's just, I think it's a win-win. It's great for the patient, quicker recovery. I feel comfortable knowing that I've explored their pelvis thoroughly, and so I just think it's a great tool to have in your toolbox as a surgeon.